India makes steady progress in its fight against COVID-19. Less than 3 lakh daily new cases for the 8th successive day. Recovery rate rises further to 88.69%. Union Health Minister Dr. Harshvardhan says steps are being taken to tackle a surge in mucormycosis cases. More than 1 crore vaccine doses. Good morning, welcome to English News. I'm Anil Thomas. Now for the stories in detail. India is making a steady progress in its fight against the coronavirus pandemic. India's daily recoveries continue to outnumber the daily new cases for the 11th consecutive day. The national recovery rate has risen to 88.69%. 10 states account for 72.23% of the new recoveries. In another positive development, India has recorded less than 3 lakh cases for the 8th consecutive day. Let's take a look at this report.
India is battling COVID-19. The country has recorded less than 3 lakh daily new cases for 8 consecutive days now. The gap between daily new cases and daily recovered cases has reduced. 2,22,315 daily new cases were registered in the last 24 hours. India's daily recoveries continue to outnumber the daily new cases for the 11th consecutive day. 3,02,544 recoveries were registered in the last 24 hours. India's total active case load decreased to 27,20,716 on Monday. A net decline of 84,683 is witnessed in the last 24 hours. It now comprises 10.17% of the country's total positive cases. India's cumulative recoveries have reached 2,37,28,011. The national recovery rate has grown further to touch 88.69%. 10 states reported 81.08% of the new cases in last 24 hours. Tamil Nadu has reported the highest daily new cases at 35,483, followed by Maharashtra with 26,672 new cases. Active cases have decreased since its last peak on 10th May 2021.
पिछले 22 दिनों से कंटिन्यूअस डिक्रीज इन एक्टिव केसेस देश में नोट किया जा रहा है, जहां 3 मई के समय पर देश में एक्टिव केसेस 17.13% थे, वह घटते घटते अब 10.17% रह गए हैं। 10 मई के समय पर देश में 37,45,000 के करीब एक्टिव केसेस थे, तो वह कम होते होते 27.2 लाख केसेस एक्टिव केसेस की दृष्टि में देश में हैं।
The cumulative positivity rate now stands at 8.09%. Weekly positivity rate has also declined to 12.66%. Currently, in 197 districts, the positivity rate is below 5%.
वीक एंडिंग 7 मई 21 में जहां देश में ऐसे 92 डिस्ट्रिक्ट थे, अब वह संख्या बढ़कर 197 डिस्ट्रिक्ट हो चुकी है। यानी कि 105 डिस्ट्रिक्ट ऐसे हैं जहां पर कि इन्फेक्शन का जो कंट्रोल है वह रिलेटिवली फर्दर स्टेबिलिटी की तरफ जाते हुए दिखाई दे रहा है।
The Health Ministry emphasized on taking the treatment to the patient's doorstep as it will reduce the burden on the health system in rural areas.
अब ग्रामीण प्रांतों में या सेमी अर्बन एरियाज में अगर केसेस पाए जा रहे हैं, तो जैसे कि गवर्नमेंट ऑफ इंडिया ने स्टेट गवर्नमेंट को गाइड किया है, उनके साथ परस्पर उसको एक एक्शन प्लान के थ्रू काम कर रही हैं। जरूरी है कि रूरल एरियाज, पेरी अर्बन एरियाज और ट्राइबल एरियाज में भी जहां पर कोई भी अगर बीमार होता है, वहीं पर हम उसकी उपचार की सुविधा प्राप्त उसको उपलब्ध करा सकें, उसके तहत भी उतना ही कार्य करना हमारे आगे वाले मार्गदर्शक सिद्धांत में आता है।
रूरल और सेमी अर्बन एरियाज में अब केसेस देखे जा रहे हैं और इसलिए ये ज़रूरी है कि वहाँ के लिए प्रॉपर डायग्नोसिस और मैनेजमेंट की गाइडलाइंस बनाई जाएं, उस ट्रेनिंग की जाए। इस पे भी काम किया जा रहा है कि सिंड्रोमिक अप्रोच हो, रैपिड एंटीजन टेस्ट के यूज़ हो, तो लोग घर पे कर सकें।
A total of 19,28,127 tests were conducted in the last 24 hours in the country, and cumulatively 33 crores 5,36,064 tests have been done so far. Union Health Minister Dr. Harshvardhan on Monday chaired the 27th Group of Ministers meeting on COVID. He reviewed steps currently being taken for COVID-19 management as well as the overall prevailing situation. Speaking on black fungus, the minister advised people on the early detection and management. He added that states have been asked to inform the centre about the numbers so that strategies and drugs availability can be planned accordingly.
Many actions have been taken for advice with the advice of the relevant experts, and we had requested the states to issue notifications to make this disease notifiable so that the central government also knows in detail the extent of the numbers, and so that the strategies could be about drug availability etc. could be planned accordingly.
Dr. Randeep Guleria, Director of AIIMS, also spoke on black fungus.
अगर हम डेटा देखें फर्स्ट वेव का सेकेंड वेव का, तो डेटा बहुत सिमिलर है और ये यही दर्शाता है कि जो बच्चे हैं वो प्रोटेक्टेड रहते हैं, उनको कम इन्फेक्शन होता है और अगर इन्फेक्शन भी होता है तो बहुत माइल्ड रहता है। और ये वायरस तो वही है, वायरस तो चेंज नहीं हुआ है, तो इसलिए ऐसा कोई लक्षण, ऐसा कोई इंडिकेशन नहीं है कि जो थर्ड वेव है उसमें बच्चों में ज़्यादा होगा।
Overcoming all hurdles and finding new solutions, Indian Railways is continuing its journey of bringing relief by delivering liquid medical oxygen to various states across the country. So far, Indian Railways has delivered more than 16,023 metric tons of liquid medical oxygen in more than 977 tankers to various states across the country. It may be noted that 247 oxygen expresses have completed their journey so far and brought relief to various states. Oxygen expresses started their deliveries 30 days back on 24th of April in Maharashtra with a load of 126 metric tons oxygen. Within 1 month's time, Indian Railways has delivered more than 16,000 metric tons of liquid medical oxygen to 14 states across the country. Highest ever single day load of more than 1,142 metric tons of relief delivered by Oxygen Expresses yesterday. Previous best was 1,118 metric tons on 20th of May 2021. The Modi government is leaving no stone unturned in tackling COVID-19 across the country. With inputs from Nitendra Singh, DD India.
Well, India crosses a major landmark with more than 1 crore vaccine doses administered for people between the ages of 18 and 44 under phase 3 of vaccination drive. In a big boost in our fight against COVID-19, the Union Health Ministry has taken a major decision on vaccination. It has decided to give the facility of on-site registration or facilitated cohort registration on the COVID digital platform for the 18 to 44-year-olds. Bharat Biotech has also started trial of Covaxin's booster dose at AIIMS. Manufacturing of Sputnik vaccines have also begun in India. All this and more in the next report.
India added another feat in its historic fight against COVID-19 on Monday. Vaccination efforts to fight the deadliest pandemic got another shot in the arm on Monday. In the third vaccination drive for the age group of 18 to 44, the jab crosses 10 million mark. 10 states accounted for 66.30% of the total doses given in the country.
We have already given 19 crore 60 lakh 51,962 doses to our countrymen, and even today we have 1 crore 60 lakh 57,858 doses which are still available with the states to vaccinate people at this point of time.
Centre has so far provided 21 crore 80 lakh 51,890 COVID vaccines to states and union territories. More than 1 crore 80 lakh 43,000 vaccine vials are still available with the states and union territories from Centre's quota. In addition, more than 48 lakh vaccine doses are in the pipeline and will be received by the states and union territories within the next 3 days from the Centre. States and union territories like Jammu and Kashmir and Himachal Pradesh are are increasingly vaccinated. If we look at the figures of Jammu and Kashmir, COVID vaccine has been given to 29,73,377 beneficiaries in the state. Out of these, 24,35,402 beneficiaries have been given the first dose, while 5,37,975 have been given the second dose till Monday morning. More than 15.72 lakh beneficiaries have been vaccinated in Jammu division, while more than 13.88 lakh people have been vaccinated in Kashmir Valley. Meanwhile, the government of Jammu and Kashmir has decided to intensify vaccination in the age group of 18 to 45 from the 25th of May. The government has set a target of vaccinating 40,000 to 50,000 people per day from 25th of May. In a big boost in fight against COVID-19, Union Health Ministry has taken a major decision on vaccination. The Union Health Ministry has now decided to provide the facility of on-site registration, cohort registration in CoWIN digital platform for the 18 to 44 years of age group. Now, people between 18 and 44 years will be able to apply the vaccine without online registration through on-site registration. Such people will now also be able to register at the vaccination center. However, at present, this facility will be available only at the government-run centers. The center of private hospitals will still have to register online and book a slot for the vaccine. From 1st of May, the government had announced vaccination drive for the age group of 18 to 44. It was mandatory to register online and book available slot and then go to the center to get the jab. There were reports that people booked vaccination slot but not reaching for the same. So in such a situation, vaccination slots were wasted. But now the remaining vaccines will be utilized for non-online registered persons. In the meantime, Bharat Biotech has started trial of Covaxin booster doses at AIIMS on Monday. Booster was given to those who had already taken second dose and is being ascertained that how it works.
बूस्टर डोज का मतलब होता है कि इम्यून रिस्पांस को बूस्ट करना। जब भी प्राइमरी इम्यूनाइजेशन कर लेते हैं, प्राइमरी इम्यूनाइजेशन इसके लिए कोविड के केस में फर्स्ट और सेकेंड डोज है, 2 डोज देने के बाद जो है हम जो है फिर जो है बूस्टर डोज की बात कर रहे हैं, एक एविडेंस जनरेट करने के लिए कि हो सकता है बूस्टर डोज जो है इम्यूनिटी बूस्ट करे, प्रोटेक्शन बेटर हो, उससे हो सकता है न हो, तो अभी तो एविडेंस जनरेट करने की बात है।
आई एम प्रेइंग कि हाँ सब सही रहे और जो बूस्टर डोज लगी है इट गोज गुड।
हमें भी अपनी इम्यूनिटी बढ़ानी चाहिए, इसके लिए हमें ये ज़रूर लगवानी चाहिए।
The center has extended the duration of the second dose of the Covishield vaccines a few days ago. Now, the second dose of the Covishield vaccine may be availed in between 12th and 16th week. However, the second dose of Covax to be taken only after 28 days. No changes have been made in this regard. Experts say that the decision on the Covishield vaccine has been taken on the basis of scientific evidence. In Britain, the efficacy of Covishield is found to be 65% to 88% when second dose is given around 3 months.
For Covishield, the interval has been increased from 6 to 8 weeks, from 6 to 8 weeks to 12 to 16 weeks. That means, in other words, simply 3 to 4 months. Now, this has been based on scientific evidence. We got it real live data from UK, and which suggested that if a single dose is given and the interval before the second dose is given, the protection provided is between 65 to 88%.
Experts have also advised to the patients who recovered from coronavirus should not make haste for vaccine as their antibody remains at least for 6 months.
There are international studies from UK and North America which suggest that if somebody gets COVID infection, the antibodies persist for 6 to 7 months. So person is very well protected after an episode of acute corona illness. And in view of this evidence, the group decided to defer the vaccine. If the vaccine has not been given, first dose is deferred by 3 months. If one dose has been given, you defer, and somebody unfortunately gets a corona infection, then you defer for 3 months and then give the second dose.
In a good news, RDIF and Panacea Biotech have started manufacturing Sputnik vaccines in India. A target of 100 million vials per year has been set. Vaccination is the biggest weapon in the fight against COVID-19, and centre and states are providing free vaccines. But it's high time that people of the country should realize their own responsibilities and duties and follow scientific way of prevention of this virus, maintaining social distancing, 2 गज की दूरी, to save their loved one from the infection. With Nitendra Singh, Bureau Report, DT India.
Well, states are continuing to take appropriate measures to break the transmission of COVID-19. Some states have extended the lockdown or curfew till 1st of June. Some states such as Uttar Pradesh, Madhya Pradesh and Bihar registered a fall in new infections and positivity rate.
The period of lockdown in Bihar has been extended till June 1st to stop the pace of COVID-19 infections. Chief Minister Nitish Kumar has given this information on Twitter. In view of corona infection, lockdown was imposed on 5th of May 2021 for 3 weeks. There's positive impact of lockdown and a reduction in infection has been noticed. So it's been decided to extend the period of lockdown till 1st of June. In Uttarakhand, COVID curfew has been extended till 1st of June. In this period, shops of essential goods will remain open from 8 am to 11 am. Haryana is gearing up to fight the third wave of COVID-19 that may come in near future. An integrated program, namely Sanjeevani Pariyojana, has been launched to fight the pandemic. Under this project, better treatment would be provided to severely affected patients. In COVID centers, 30,000 beds will be made available besides 20,000 ventilators and oxygen beds. As of now, positivity rate in Haryana is around 9%. The state health minister hinted that restrictions may be relaxed after reduction in the rate of infection.
पॉजिटिविटी रेट है अभी 9% के पास है. जब तक वो 5 से नीचे ना आ जाए तब तक ज़्यादा ढील दी नहीं जा सकती.
There's a downward trend in cases of new infections in Uttar Pradesh. In last 24 hours, 3,981 cases surfaced in the state. There's increase in the recovery rate, which has become 94.3%. 157 people lost their lives due to COVID-19 in the last 24 hours. Chief Minister Yogi Adityanath is working with the missionary zeal to fight the pandemic. After Jhansi, he visited Gonda and Azamgarh district on Monday. In the morning, he took stock of preparedness of the district hospital of Gonda. He also visited a primary health center of the district and later he reviewed the preparedness to fight COVID-19 in Azamgarh.
80,000 वेंटिलेटर युक्त और ऑक्सीजन युक्त बेड्स प्रदेश के अंदर उनकी क्षमता विस्तार किया, जहां पर प्रदेश के हर नागरिक को वहां पर निःशुल्क स्वास्थ्य की सुविधा, कोरोना से उपचार की सुविधा उपलब्ध किया जा सके और ये हम सफलतापूर्वक प्रदेश के अंदर कर रहे हैं.
In Delhi, 1,550 new cases of infection came to notice in the last 24 hours. In this period, 207 people died due to COVID-19 infection in the capital. Meanwhile, CM Arvind Kejriwal reviewed the status of imported oxygen cylinders in Mayapuri. Thanks to the central government, 6,000 cylinders have reached Mayapuri. On the other hand, South Delhi Municipal Corporation has established a COVID care center for children in Malviya Nagar.
फिर आपने पहले भी कई कोविड केयर सेंटर देखे होंगे, लेकिन इस किस्म का नहीं देखा होगा. रिक्रिएशन की सारी फैसिलिटीज़, एक साइकोलॉजिकल बूस्टिंग अप का एक एटमॉस्फेयर यहाँ बनाया गया है. अलावा उसके जहाँ तक एक प्रोफेशनल मैनेजमेंट का सवाल है, कोविड या हमारे आकाश हॉस्पिटल की तरफ से पूरा का पूरा एक प्रोफेशनल मैनेजमेंट रहेगा.
Other states of the country are also working hard to fight the pandemic. Jharkhand CM Hemant Soren reviewed the preparedness of the state in the fight against COVID pandemic through video conferencing. In Madhya Pradesh, also the rate of infection is coming down. However, positivity rate in the state is still 4.2%. The government aims to get control over the infection by 31st of May.
पॉजिटिविटी रेट भी घट गए, अब 4.2% हो गया है, लेकिन अभी सतर्क रहने की जरूरत है. कुछ जिले अब अनलॉक होने लगे हैं, उसके परिणाम भी हमको देखने पड़ेंगे. धीरे धीरे प्रदेश को उस दिशा में ले जाएंगे, लेकिन 31 तक हमारा लक्ष्य संक्रमण को पूरी तरह से काबू में कर लेना.
In Karnataka, the government has already extended the period of lockdown till 7th of June. The restrictions are strictly implemented in the state to break the chain of infections. State Home Minister briefed on cases of mucormycosis in Karnataka and its fight against COVID-19.
This house should be used to the people. So I have converted that. We have got all the facilities there. Oxygen concentrators are there. Medicines are there. Doctors are there. 3 shift. Nurses are there.
In Tamil Nadu, lockdown has been imposed for a week with strict restrictions. New cases of infection are increasing in the state at a fast pace. Meanwhile, State Health Minister M.A. Subramaniam inaugurated a COVID-19 hospital in Chennai with 300 beds. In Jammu and Kashmir, Indian Army along with an NGO distributed food packets to the needy people at Srinagar. In Kathua district along the border, Harinagar Panchayat has made a COVID care centre having 5 beds. Oxygen cylinders are also available there. The decision to make COVID-19 centre at Panchayat level has been taken after the direction of the LG of the Union Territory.
Appropriate building identify कर जो कि पंचायत घर भी हो सकता है या फिर हमारे दूसरे इदारे हैं जिसमें स्कूल या फिर हमारे हेल्थ के सब सेंटर या फिर PHC उनको कोविड केयर सेंटर वहाँ पर जो है 5 बेडेड का बनाया जा रहा है.
As of now, strict restrictions are in force across the states which are bringing positive results in its fight against COVID-19. Bureau Report, DD India.
Well, shifting focus, cyclonic storm Yas over east central Bay of Bengal has intensified into a severe cyclonic storm. The Indian Meteorological Department has said cyclone Yas will cross between Paradeep and Sagar Island around Balasore in Odisha during the noon of 26th of May. As cyclone Yas looms closer to the eastern shores of India, states like Odisha, West Bengal and Andhra Pradesh have sprung into action to ensure minimum loss of life and property. 48 NDRF teams airlifted from different locations and are deployed in West Bengal and Odisha. The Odisha state government has rushed a large contingent of rescue and relief teams to Balasore district bordering West Bengal, where the severe cyclonic storm Yas is likely to make the landfall. With an aim to tackle the cyclone amid the ongoing coronavirus pandemic, all arrangements have been made for a smooth evacuation following COVID norms. North coastal district of Andhra Pradesh is also bracing for a severe cyclonic storm, which is predicted to hit the eastern coast on the 25th and 26th of May, and the supply of liquid medical oxygen to the state may be hit. Earlier on Monday, Union Home Minister Amit Shah held a meeting via video conference with the Chief Ministers of Odisha, Andhra Pradesh, West Bengal and the Lieutenant Governor of Andaman and Nicobar Islands to review the preparations in view of Cyclone Vyas. The Union Home Minister stressed on the need to ensure uninterrupted power supply to hospitals and COVID care centres, particularly ICUs in the cyclone-prone areas. The Delhi Police Special Cell on Monday evening raided the office of Twitter in the national capital in connection with a probe over the alleged Congress toolkit. While confirming the presence of the officials of Delhi Police Special Cell at Twitter's office in Lado Sarai, this all happened because last week the Congress had filed a police complaint against BJP leaders with regards to this particular story, and many senior leaders were mentioned in that. The Delhi police said this was necessitated as they wanted to ascertain who is the right person to serve a notice, as replies by Twitter have been very ambiguous. The police, however, refused to divulge the contents of the complaint or the identity of the complainant. External Affairs Minister Dr. S. Jaishankar is on a 5-day visit to the United States from May 24th to 28th to strengthen COVID-related cooperation between India and the US. It is his first visit to New York after India entered the United Nations Security Council on the 1st of Jan 2021. There are 2 interactions scheduled between the Indian delegation and the Business Forum to discuss economic and COVID-related cooperation between the 2 countries. External Affairs Minister is also meeting United Nations Secretary General Antonio Guterres in New York. His schedule also includes meeting and holding discussions with his counterpart, Secretary of State Anthony Blinken, in Washington, D.C. A meeting with cabinet members and senior officials of the administration dealing with the bilateral relations is also on the agenda. A quick look on COVID-19 situation from across the world. The virus has infected more than 16 crore 79 lakh people, while the number of recoveries stand at 14 crore 92 lakhs globally. Over 34 lakh 86,000 fatalities due to COVID-19 have been reported worldwide. United States continues to remain the worst hit country by the pandemic, both in terms of infections as well as fatalities. In terms of infections, 3.39 crore people, and in terms of fatalities, over 6 lakh deaths. Well, that's all we have time for in this edition of news. Remember to take care of yourself and also your loved ones. We all need to see a better tomorrow. Thanks for watching. Bye-bye. Take care.